NJR Medical, helping medicine help people. The No-Bite 5, a faster and safer way to use oral hygiene and tracheal suctioning devices that are clinically proven to decrease HAP and VAP.
This is the laryngopharyngeal area, right up here. To reach this area with the no-bite, you just have to insert the suction catheter a few inches past the tip, about that far. As you can see, this would reach the back of the throat, aka laryngopharyngeal area. This method allows you to suction a lot further than what a traditional Yankar suction would be able to reach. This area is actually above the bifurcation that splits off in between the esophagus and trachea. So there's really no technique involved of depressing the tongue. Just anywhere you put it is going to be the right spot because you're actually above the bifurcation, which is the laryngopharyngeal area. To facilitate opening the airway of the patient, always take out your pillow first and tilt the patient's head back. Only if the patient's condition is deemed appropriate, tilt the head back. Make sure you always check with your doctor first. Another good tip is to always have your suction catheter obviously connected to your suction tubing. Make sure your tubing is connected to the wall and it's turned on to the appropriate level before you begin. You don't want to be wasting time in the patient's mouth. Another good tip is to preload your suction catheter into the no-bite. Basically, you just put your suction catheter to the tip before you begin. Another good tip is to have your pointer finger holding the suction catheter almost like you're throwing a dart. Basically, by holding the suction catheter, the weight won't pull it out. But if your finger's not there, it could slip right out on accident. A lot of times when you are entering the patient's mouth with the No-Bite 5, the patient's going to want to bite down on the device. Our tip is basically to have your hand with your thumb on his chin and push down on his chin. That way it prevents him from biting as you enter the patient's mouth with a no-bite. Obviously check with your doctor and make sure it's appropriate and okay to push down on your patient's chin. So sometimes with nasotracheal suctioning, you have your patient moving around or lifting his head when you're trying to suction him. So you might need a second person in the room to help you. With the No-Bite 5 approach, we highly recommend that you have two people doing it at the same time. One person's actually going to be holding it, putting it in the mouth. The other person's actually going to be feeding the suction catheter through to the device. It just makes it a lot easier and faster for the patient. So basically, make sure your suction catheter is preloaded. Obviously, your suction would be turned on. You have your hand on the patient's head, so you're stopping him from wiggling, as well as you have your thumb on his chin to hold down his chin so he can't bite down. So you have him just like this. You pull down the chin. You enter your No-Bite 5 into the mouth, depress the tongue, and then your partner is right at the side here, and he will insert the suction catheter, and it goes straight down. What also is important is make sure you have the proper angle of the no-bite in the patient's mouth. The best angle is right here. This just facilitates opening the airway when you depress on the tongue. You don't want it down like this. This doesn't really help you. And you obviously don't want to be bashing the patient's teeth because that's not good either. So just about in the medium, a little bit higher of an angle, and that will help you facilitate opening the patient's airway. Another key point is don't hesitate. The No-Bite 5 is a simple device, simple to use. Basically, know what you're going to do, practice a little bit before you have to do it. Maybe even practice on a dummy head if that makes you feel better. And just don't hesitate. If you're in the mouth and you're hesitating and you're wasting time, you're just unnecessarily gagging the patient. You want to know what you're doing beforehand, go in there, boom, 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 suction out your patient, and be done. That way it's less stress on your patient and also easier for you. So if you come across a patient who is hunchback or has a slouching posture, you could see that in the neck of somebody who's doing this, it changes their anatomy. You'll actually be more apt to go into somebody's esophagus instead of going in the trachea. So a way to correct that, as long as it's okay with your doctor, is to get a rolled up towel. You basically just roll up a towel and have a person sit forward, and you just put a rolled up towel, okay, go ahead, right across their shoulder blade, have them lean back, and this actually opens up their airway now to the proper positioning. Now that you've finished the training section, a return demonstration of the two-person approach of oral tracheal suctioning with the No-Bite 5 on a dummy head is mandatory for certification. Remember, practice on a dummy head so you are not practicing on a person.
NJR Medical. Helping medicine help people.